One of the first questions people ask when considering any form of implant-based restoration is whether or not getting dental implants is painful. To answer this question, we need to break the process down into surgery and post-surgery. Firstly, patients should feel no dental implant pain during the surgical process. The reason for this is twofold. Experienced clinicians utilize the latest 3D technology to plan the implant process before a patient undergoes surgery. An accurate 3D virtual mock-up of your jaw ensures that an ideal prosthetic rehabilitation is facilitated. Digital guides provide the right implant trajectory and depth, avoiding specific anatomical structures. Therefore, the surgical process is carried out with pinpoint precision and is relatively quick. In addition, the use of the latest local sedation techniques ensures that the patient remains relaxed and comfortable during the process. The second phase of the treatment occurs after the implants and the fixed prosthesis is placed, where a short amount of healing time is required. In some cases, prostheses are fitted within 24 hours. Because digitally guided placement requires minimal cutting, the healing period is quick. Most patients recover fast and are back to normal within 7 to 14 days. However, they may feel slight discomfort for the first few days after surgery. This type of dental implant pain is natural, along with some bruising and swelling. However, the degree differs from patient to patient. 24 hours after implant surgery, you should avoid rinsing, spitting, or touching the implant site to avoid contaminating or irritating the implant site. Typically, any discomfort should be brought under control using over-the-counter medication like paracetamol, ibuprofen, or aspirin, and any swelling or bruising can be eased using cold compresses. To minimize swelling, keeping the head elevated where possible is key. Extended periods of implant pain are very uncommon post-surgery, so you should contact your dentist if you cannot control the discomfort or experience prolonged bruising or swelling. Even though you have a complete set of teeth, it's essential to avoid placing too much force on the implants until they have fully stabilized in the jaw. Excessive pressure applied to the implant early may force it further down onto the bone, causing slight discomfort. For this reason, patients should avoid eating and chewing excessively hard foods like candy. Instead, stick to softer foods high in protein like fish, eggs, and cottage cheese. You can gradually introduce foods, but your dentist should assist you with a dietary plan to avoid dental implant pain in the first few weeks after surgery. The final part of the implant process is stabilization. We've already mentioned that the implant needs to stabilize the jaw to achieve optimum efficiency fully. Complete implant stability is achieved when the bone tissue fully fuses with the titanium implant to become part of the jaw, known technically as osseointegration. This can take anywhere between 2 and 5 months, depending upon the healing abilities of the individual patient. Because patients should feel no dental implant pain during this part of the process, they're free to live their lives as they usually would, although some dietary restrictions may still apply. So, to recap, during the implant surgery itself, patients should feel no pain. Slight discomfort may be present for the first few days after surgery, but typically this is minimal and is easily controlled using over-the-counter medication. Bruising and swelling may also be present, but frequent cold compresses should help ease any dental implant pain. Finally, avoid crunchy or hard foods until the implants have fully stabilized in the jaw. The process of osseointegration takes several months and should not result in discomfort, allowing you to live life normally.